All right, so it is time now to think about vaccines, time to think about Georgia in the COVID world and how we are doing as a state. So this is an extremely timely topic. I want to welcome David Ross to the screen, who's going to get us started. David, so great to see you. I know we had a new member introduction for you just about a month ago, and here you are again. So you're back on stage, part two. For those of you who don't know David, he's president and CEO of the Task Force for Global Health, which is one of the largest nonprofits in the world. He took that post in 2016, but David, you'd been with the Task Force for at least 16 years from what I remember, and you, of course, had a long 35 years really providing incredible leadership in public health information, informatics, and data generation to solve problems. So you just deep leadership, deep insights. Thank you. So I understand you've got about 8 minutes of your own prepared remarks, and then you'll introduce our main speaker.
That's right.
Well, great. Well, thank you.
All right. Well, good morning, everyone. I guess it's now afternoon. Good afternoon, everyone. One of these days, I hope I also can join you in person. It would be a delight to actually see you as humans, face to face. Well, today, what we are trying to do is, thanks to my colleague, Dr. Kathleen Toomey, our Commissioner of Health, State Health Officer, is to bring you an update on the COVID pandemic, primarily in her remarks about Georgia. I'm going to provide just a few minute overview, what's happening nationally and globally, and then we'll get on with Dr. Toomey. I should remark, however, that Kathleen's very brief bio that she submitted does not do justice to this woman's career. Kathleen, shall we say, is a friend of long standing, but she has one of the most unusual people. She has marched through the jungles of the Amazon. She's treated patients in the northern parts of Alaska. She has been a deputy director of the CDC. She ran the CDC Botswana Global Office, and she has twice been Georgia's state health officer. She's a very accomplished woman, and we're indeed lucky to and fortunate to have her during this very challenging time. I also want to just note that the last time she and I were able to get together face to face was at the home of President Lee Okadiah-Zach's house. Lee is the president of Agnes Scott College, and Lee brought us all together to, along with other public health professionals, to explore needs for public health curricula, because that's a major course of study at Agnes Scott College. And I must give a shout out to Agnes Scott, because I am, in fact, a trustee at this pretty magnificent school and a real gem for Georgia and the U.S. Also, before I make my opening remarks, I want to thank Sonny Derizo, a man many of you know very well, longtime Rotarian and member of Rotary International. Sonny helped us recruit Gita Manket to our board. Gita is a member of Rotary International. She lives in Nairobi, Kenya, and we are thrilled to have her. So thank you, Sonny. We really appreciate it. Now, and also, just if I take a moment to tell you a bit about the Task Force for Global Health, so you can have some perspective of where we sit in this global COVID response. At our core, we are an institution that believes that all people have a right to health, that we must maintain a laser focus on results and creating impact, and that the way to get there is with partnerships. Those partners extend your ability to affect broad change. So, next slide. Next slide after this. Okay. You can see from this slide, we work in lots of places. In fact, we work in right now over 150 countries, and our objective with all of our different programs in these countries is to bring about health equity, to help people have access to services and care and supplies that are needed to be healthy. Next slide. This slide shows you some of our accomplishments. And from these, what you first will see is that we work at a very large scale. We treat over several 100 million people every year for a range of diseases. We bring millions, in fact, billions of treatments of drugs all over the world. And we train the disease detectives, the field epidemiologists, who are the people that eventually help countries protect the health of their populations. And I'm proud to say we are a winner of the Hilton Humanitarian Prize. Next slide. We work in three major areas. We work to eliminate diseases like polio and viral hepatitis and a range of diseases that are referred to as neglected tropical diseases. We also are involved in ensuring access to vaccines, and this also includes working with the Brighton Collaboration, which is one of our programs, to assure vaccine safety by guiding vaccine safety trials correctly. And we strengthen health systems. We do this principally by training field epidemiologists and by helping the states in the United States and countries around the world develop the information systems and surveillance systems they need to inform action that protects the health of populations. And we also work in the world of medical surplus recovery, distributing unused but still very useful drugs and supplies. Next slide. So with the onset of COVID-19, we've begun playing a number of roles related to response to the pandemic. As I mentioned, we work to train the disease epidemiologists that are working in all the countries, over 150 countries that we work in. We are actually have training programs in about 100 countries. We have worked with Google and Apple to help develop a technology application for exposure notification by bringing their two operating systems together. That was a wonderful opportunity. And at some point when we get low enough case counts, exposure notification and follow-up to exposed persons will become a useful attribute. We've also been heavily involved in distributing medical supplies and PPE. In fact, over 9 million items of supplies have been distributed. We are helping low-income countries implement vaccines and vaccination programs. And that bottom middle picture, it depicts an innovative project we're doing with MIT's Media Lab and a set of partners in Atlanta. This project is called Health Pulse Atlanta. It's a partnership with Morehouse University, Emory, Wellstar Health Systems, and Partnership for Southern Equity. And this is really about harvesting social media and other communications to help reach people who can help educate and influence their peers and the people that trust them and their judgment to help inform people about the pandemic and, more importantly, help overcome hesitancy to get vaccinated, because we really need people to get vaccinated. And finally, I just mentioned that Dr. Patrick O'Carroll, who runs all of our health system strengthening programs, and I have served on the DeKalb County COVID task force. Next slide. So this is a busy slide, but I just want to call out a couple quick things. First off, globally, we've had over 141 million cases of COVID infection that have led to over 3 million deaths. And here in the United States, we've had more than 31 million cases that have led to date over 560,000 deaths. So we, the US, account for about 20% of deaths globally. What these particular graphics really speak to is the fact that people of color and Latino people have suffered disproportionately, and largely due to reasons of access to care and information or misinformation. and what we generally refer to as the social determinants of health. But this speaks to a major national challenge. This slide now then shows where we stand with distribution of vaccines. We are at a point where the South and the mountain states are falling behind other states in vaccination rates. This is something that I'm sure Dr. Toomey will talk about. Next slide. And globally, what we see is a very similar pattern. Again, the theme here is there's an inequity. The developed world, the rich world is becoming vaccinated. We have something like 1 in 4 people in the rich world vaccinated, and less than 1 in 500 in the low income world. And this is going to be a major challenge. The Task Force for Global Health is involved in helping start vaccination programs in up to 50 countries. And next slide. So what have we learned? I think we've learned that there are many issues of equity and access, both domestically and globally. I think because public health sits at the boundary of science and policy, what we're going to have to learn is how to help policymakers become more prepared for dealing with this kind of situation, because there will be future pandemics. And I think one of the things that Rotarians could call for universally is that as the pandemic is brought to an end over the coming year, that nationally we have some kind of after-action review to help everybody learn how we can respond to these kinds of challenges in the future, because more likely than not, they're going to happen again soon. Finally, next slide. I just want to say and note that it does always seem impossible until it's done. We're going to get there, and it's going to be in Georgia through the help of Dr. Kathleen Toomey. Kathleen, as I noted, is our state health officer and has been guiding us through a really tough time. I applaud her and all of her colleagues in public health in Georgia. They have just worked incredible hours and so hard on our behalf. And with that, I'd like to turn it over to Kathleen and ask her to update us on where we are in Georgia.
Well, thanks so much, Dave. It's so good to see you, if only on TV. I really want to say how thrilled I am to be here with the Rotary today. It's a great honor for me to be here, and it's not the first time I've spoken to Atlanta Rotary. Believe it or not, the last time I presented to Atlanta Rotary was after 9/11, when once again, we as a nation were facing a public health crisis related to anthrax and public health's role within Homeland Security. And that's just too long a time. I think what that reflects is the fact that that partnership that evolved quickly after 9/11 was allowed to languish, and we had to quickly ramp that up in order to be successful with our COVID response. What I'd like to do is very generally go over where we are in terms of numbers in Georgia, to put it into the context that Dave did of the US and globally, but spend the most time talking about our vaccinations and how in particular the business community must play a critical role working with us. And as Dave said, partnerships are everything. That's what makes public health work. And it's the partnerships with the broader business community throughout the state that will allow us to get to herd immunity, which we will need to do to have the Georgia that we want to have COVID-free. We are right now are in a plateau. That's a good thing compared to other states, particularly states like Pennsylvania and Michigan, where we're seeing some significant spikes. We have not seen that since the large spike in January after the holidays, but we hope that we can keep our numbers low. We're seeing a gradual increase in percent positivity among our testing. It's now hovering around almost 6% positivity. So we hope that's not a sign of an increase in our caseload. And it's even more important that we try to get as many people as we can throughout the state vaccinated. And in part because 50% of our cases at this time, and probably more as the numbers will be coming in later this week, are of the highly infectious variant, the UK variant. And so that we have seen the variant go from almost a negligible number of cases to the majority of our cases now. And again, that again bodes about the importance of us ensuring that we have adequate vaccination throughout the state. We have partnerships have been the critical piece throughout the course of the vaccinations. And I wanted to just comment on how we rolled out the vaccination program, which is not consistent from state to state, which I know causes some confusion. But we felt very strongly we wanted to initiate the vaccines among those who were most at risk of death or hospitalization. And so we were ensuring that those who were older, who are most at risk of either being hospitalized or death from COVID, were the first to be vaccinated, as well as those in long-term care facilities. And we've seen the benefits of that. We have the numbers of cases that we're seeing in long-term care facilities is the lowest it has been since the start of the pandemic. And we're seeing now that, unfortunately, younger people are now representing the larger number of cases and even hospitalizations. And so we have now opened up for at least a month to all individuals 16 and older. And some of the partnerships that I wanted just to mention were those with the various organizations that serve the elderly, so that we could identify those at risk and help them get registered and even get transported to vaccination facilities. Walgreens has been an incredibly important partner, not only in long-term care facilities, but also working with those with intellectual and developmental disabilities. We've had special clinics for these individuals who might otherwise not feel comfortable in one of our big mass vaccination sites. We've also been working very diligently on how to address the health equity that that Dave has mentioned. We anticipated that we would see a lot of vaccine hesitancy in communities of color. And with that, we were able to stand up an equity council. It's chaired by Dr. Montgomery Rice from Morehouse, but also to have over 19 individuals throughout the state, including Santiago Marquez from the Latin American Association, Norma Hernandez from the Latin American business community in Gainesville. So throughout the state, we have worked with them to set up smaller sites, either with churches, or community organizations. We call them pop-up sites or even just community vaccination centers, where rather than doing thousands of vaccines as we are currently doing in Mercedes-Benz Stadium, but we are doing hundreds, but those hundreds represent individuals who might otherwise not come to be vaccinated. And we see this as a really important and creative way to address vaccine hesitancy in communities of color. I do want to also give a shout out to the business community that has been with us really from the start, because I think all of us recognize the best way to open businesses throughout the state was to ensure that individuals were protected from COVID. And a big shout out to Delta. Delta has played such a leadership role with us, not only with their own employees, offering testing as well as vaccination. But as we opened up gradually to individuals, Delta also opened up a vaccination site open to the public. And they're Their site at the Delta Museum, which serves both South Fulton and Clayton, is one of the most popular and effective vaccination sites to reach communities of color. And we are really grateful to them for their work with us. Other industries have been extremely instrumental in reaching both their workers and potentially family members in the Hispanic community. This is also the poultry industry. I shout out to Mike Giles from the Poultry Federation, who's been able to work with us throughout the industry, as well as the Mohawk Carpets and the other carpet industries have likewise been able to facilitate with us vaccination for their workers and to help us better reach these individuals. I also wanted to just say that as we've been able to roll out these special vaccination sites, we have seen a gradual acceptance of vaccine among communities of color. And so I was really quite surprised as we move forward that where we were seeing the most hesitancy was not in these communities of color, where we were able to work with community leadership, with our equity council, with the business community, but among rural white Georgians who are not vaccinating. And the low vaccination rate you see in our state is driven more by that than from our inability to reach the communities of color. And we will continue to reach out with these smaller vaccination sites. But what those messagings should be is something that I'm not certain about. And I would love to have your feedback about how to reach these individuals, because without more widespread acceptance of vaccination, we will not be able to reach that herd immunity statewide that we need to be able to open all businesses fully without risk of continuing to spread this virus. We've thought about working with this sports leadership, and I again want to shout out to Steve Coonan, who spearheaded a very nice PSA and press conference with the Hawks. Steve Cannon also was working with Atlanta United, and so we are trying to do as many different things as we can to reach everyone throughout the state. But we like many other my Southern commissioner colleagues are finding that same challenge, and we're hoping that we can continue through work with the business community, whether it be through incentives or simply by the leadership that the business community provides, can change hearts and minds about the importance of vaccination. I think a finger wagging by the Commissioner of Health is not going to change people's minds. It's going to take leadership in the business community, leadership in the local communities, leadership among faith leaders to really, I believe, get to where we need to be as a state. I want to just close with three take-home messages that I want to leave you with. One, COVID is still with us. We aren't where we need to be. We we can see the light at the end of the tunnel, but we aren't there yet. We still need to continue to vaccinate, and we need the help of the business community to do that, whether it be with incentives, with the leadership, with communications, working with their own employees and family members, or as in the case of Delta and some other organizations with the community at large. Second, that the business community has to play an integral role in our continuing ongoing COVID response, whether it be with mitigation, education, and work with us in public health. And last but not least, I want to say, perhaps reflecting back on my initial comment, is that public health is essential to the health of the community. And I think that we need to continue these partnerships, we need to continue these discussions, we need to continue to strengthen the work together between public health and the business community, because I can make a strong business case that a strong public health with strong community health, it will be an asset to business and will be an asset to drawing business to Georgia. And I think that as we move forward and continue that to COVID and beyond, I hope that will be the legacy we leave behind us in this pandemic. So thank you very much for this opportunity to talk a little bit about what I've been doing 24/7 for a year and a half. And I would love to answer any questions you may have.
Kathleen, thank you. As questions queue up, I will ask them, but I do want to remark and second what you said about thanks to Delta and others in the business community and sports communities who have stepped forward and helped set up vaccination sites. I think it's all part of getting the job done. And you've noted the problem now in Georgia. We're making some progress in getting the message about vaccination to communities of color, but are struggling at getting the more rural white populations to either come forward for the vaccine or even, I think, want to get vaccinated. And there's a lot of misinformation going on around the country. And it's regrettable that, in my view, that this pandemic was politicized in the way it was, that made it harder to respond. I wonder how you look at the idea of a fourth wave. Do you think, nationally, I had a slide up, but for just a moment, so people really couldn't look at it, but it was really the national epi curve showing the first wave started to go down, then we went up to the big peak and came down, and we went up to a third one. Seems as though every time we nationally have some kind of a holiday or a spring break, everybody runs off and gives up idea of wearing masks, and we come back and we have another round of infection. We are clearly seeing, I think, a fourth wave in Michigan. That's my guess. What do you think about Georgia? Do you anticipate that, or do you think you're gonna be able to keep, or collectively we'll keep the infection rate continuing to decline?
Well, as I mentioned, our percent positivity is going up. I think we are at the cusp of making a change, but it's us. The future is ours to prevent, I guess, is what I'd like to say. I think if we can continue as onerous as I know it is to many people to socially distance, to wear a mask when you're in a crowd, and to by all means vaccinate, we can stop the spread and the increasing caseload. We want to stop the spread as quickly as possible because it's that rapid spread that allows the variants to develop, and the variants themselves are so easily transmitted. But we have to continue minding those public health messages, even as we do feel that we are seeing the light at the end of the tunnel. And if we can do that, I believe we can avoid having that fourth wave or a continuing slow uptick. Yeah. I would like to think we can do that, particularly if we can encourage more individuals to get vaccinated. We have plenty of vaccine now. In fact, we have so much vaccine that there's no need to register in many of our vaccination sites. You can walk up and get vaccinated, which is different than it was initially when vaccine allocation was so limited. And I know there was a lot of concern about that. But right now we have an abundance of vaccine statewide without individuals wanting to be vaccinated. So I hope that we will not go the way of Michigan, but it really depends on how everyone over the next couple of weeks remembers the presence of the virus and is willing to continue to take those steps.
Yeah. Well, Ty, you mentioned the variants. We have a question that with the global population that is so under-vaccinated at present, do you expect to see virus variants spike in cases in Georgia?
Well, right now, the virus variants are spiking. I mean, basically, we are already there with over half, and probably when we get the data this week, probably close to 65% of our cases are the variants. And I think it's inevitable. I think it also is extremely important, Dave, that you work to ensure that there's vaccine worldwide. Yep. I mean, you can't end a pandemic in a single country. A pandemic, by definition, is throughout the world, and a global pandemic has to be addressed globally. And I am concerned because so many of us, I put myself in that category, want to get back to travel, particularly international travel. And it's going to be very difficult when you see the kind of case rates that we see in South Africa, for example, right now, or Brazil. Several places that I would very much want to go back to. So I think that it's really, I think we need to look much more broadly than just our own response, but also to reflect on the fact that a global response is critical for our ability to get back to normal as well, whether that be business or whether that be travel and leisure.
No, you're so right. I think we all have to keep in mind that no one's safe unless we're all safe. So that we have to get everyone vaccinated. And I think for the audience today, the message is that the world is, as Kathleen said, creating enough vaccine. The challenge now is to get it into the arms of people by the billions. This is a huge challenge, and this is going to take time. And there's a hang up right now in getting vaccine to many, many countries through the COVAX facility, which is tied to the Global Vaccine Alliance and WHO. And so getting the production continued to move forward, but getting it into the supply chain to the countries, and then building those vaccination programs in these countries. That's the task we at the Task Force for Global Health have on our plate, to help create routine vaccination programs for adult vaccines like COVID and flu, because apparently COVID will become probably more in the vein of a routine immunization, not just a once in a lifetime vaccination. So it's important that countries actually instantiate the ability to receive vaccine, to acquire it and receive it, distribute it, and put it in the arms of people. As Kathleen has just said, even here in the U.S., in our own state of Georgia, we're having trouble getting it into all the arms of all the people who need it. But this is something we have to do. It's urgent, or this pandemic is just going to stay with us. I have another question here. So what are the other states that are what are other states doing that working to improve their vaccination rates? Are you in contact with your other fellow health officers to get ideas about what they're doing that might be working?
No, of course. And I want to reinforce the fact that we are on calls, either myself or my team with CDC and other states multiple times a week. And I have calls weekly, sometimes several times a week with my southern state health officials, because we have the similar kind of challenges compared to other states. I think part of it is philosophical. I think our state is a little different than Massachusetts. Right. And I think that so you can't compare the uptake in some of the other states with the uptake here, because we do have a different philosophical approach to things, and that is reflected in our vaccination rates. I think also we have a fairly large population compared to some of the other states that are more fully vaccinated, and we need to reflect on that. We have 11 million people, and about 20% of whom are now fully vaccinated, but we have a long way to go. So yes, we are talking to other states, but believe it or not, we have done several presentations because of some of the innovative partnerships we've developed, not just with the business community, but with these other institutions and organizations to reach hard to reach communities, and are teaching other states about how we're doing it. It's just that our total numbers don't reflect that good work, in part because of the other challenges that we're facing with uptake.
You may have heard when I was speaking, I mentioned, I think that we need, when this is all over, a national commission, in effect, to do an after-action review, that we really look at the whole spectrum from when this started to when we eventually bring it to its end, to understand what we could have done better, what we could have done differently, what was avoidable and what was not. And all of that, in my view, leading to help better educate the public, better educate policymakers, and then also to inform those of us in public health about how we can continue to do a better job of building public health agencies. I would want to say to our audience, running a state health department and running a public health department, the whole set of operations across an entire state, particularly a state that is geographically as large as Georgia and as large a population and as diverse, is a huge challenge. But given all that, I was just wondering, Kathleen, at this point in time, have you had any reflections about, if you could do it all over, any things that you would do differently, or things that you might have said, well, we'll wait on that, but now in afterthought, you could say, well, let's get going faster?
Well, I think one of the things that we found early on is that the infrastructure in public health was simply not prepared for this.
Yeah.
It was not prepared for the original emergence of the cases, March 2nd, 2020. I remember the day well. And it wasn't prepared to even monitor the vaccinations. And so we had to simultaneously, even as we were ramping up our vaccination, start to build a new vaccine management system. And so I think what, again, this tells me is that public health is often forgotten until there's a crisis. Yep. And it shouldn't take a 9/11 or a pandemic to remind us about the strength of public health is the strength of our communities, and those healthy communities will be an asset to business. Those are your employees. Those are our draw to Georgia as different industries are looking to come to the state. And so I'm trying to make the business case that investing in public health is a good model, and I'm hoping that even as I'm saying that, you're investing in incentives for your employees to be vaccinated, because that may be, if you have individuals on the fence, that may be the thing that tips things over. I think there's still, I just this morning, got a result of a survey that the Rollins School of Public Health did for me in follow-up about vaccine hesitancy. And while there's a large number of people still on the fence but haven't been vaccinated, and I think some of these either incentives or some of the leadership, whether it's in the community or in their place of work, will help to tip them over. There's about a third that simply do not want to be vaccinated. And given that, I think it's really going to be a challenge and a continuing, ongoing communication challenge for public health. And I would love to get feedback from the Rotary about how to address that. Because as I said, I don't believe that I'm the one who can carry that message in any credible way. I've never run any kind of outbreak, let alone a pandemic, in the age of social media. I will have to say that it has been shocking to me, the things that people will comment on. And and I think that I probably am not communicating as well in social media as others because that isn't the way I was trained or you were trained.
Mhm.
And so I think having the Hawks play a role in messaging, having Atlanta United, having others that are more up to date, as it were, in current communication modes, may be able to turn things around, because it's young people, frankly, as well, who are not that interested in getting vaccinated, and yet are often the ones who will transmit in a community without themselves getting ill.
I think that's a really important point. The communication environment has so changed from when you and I were early in the public health game. I'm like you. I realize that I'm unaware of how, other than watching my children and my grandchild communicate with one another, pretty much out of touch in how you do this. And it's the world we live in. There was one question, we don't really have time to talk, but I do want to make a comment on, about the relative allocation of effort between the federal government and states. To the audience, let me note that in the case of public health, by and large, because the Constitution does not give the federal government a direct role other than quarantine at the borders, the responsibility for public health falls to the states. Consequently, the governor and the state health officer, Kathleen, really are the game in town. Now, they can ask the federal government to come in and help, as is the case at times when states will ask CDC to come and help. But CDC does not have the right to come in and declare dominance and take over and decide what to do in our state. So the federal government has to work in partnership with the states, but it's up to the states to get the most out of the federal government's help that they can get. But the bolus of responsibility sits on Kathleen's shoulders, and that of the district health officers and all the people at the local health departments. That's where we are, and that's America. And I also want to say thank you for commenting about the diversity of our country. It is a blessing at times, and sometimes a bit of a curse. It's a challenge. But I want to thank you so much, Kathleen, for joining us today, being a part of this program. Love to have you back for another continued. I think COVID is going to be with us for a while. But with that, I should hand it back to Cannon.
Well, Dave and Kathleen, thank you both so much. And like Dave says, Kathleen, it was, I guess you were last year in 2001, right? That was a long time ago. So you'll definitely, I'm sure, be back soon with updates. And in the 1 minute or two we have left, I mean, you made so many great points, and maybe just two quick follow-up questions. One, just in terms of schools in South Georgia, that was one of the questions we had here. Mm-hmm. What is kind of the outlook, or what are you expecting with this spring? I know there's some summer plans, and then maybe even getting back into the fall, particularly in South Georgia.
We have the opportunity to offer testing to all schools statewide. We have that through our federal grants. But again, there's local control for schools, and the ultimate decision about what the schools will do and how they'll open up, and even what measures they do for mitigation, will be up to the school itself. And although I early on was recommending that the teachers, as well as the students themselves, wear a mask. Again, the schools may or may not decide to do that. But even say within vaccinations, and relatively few of our own public health staff have been vaccinated in rural Georgia, and a surprising number of teachers have not been vaccinated as well. And I think that's a problem that we need to address, even as we think about how schools will open up, because all of us want schools to be not only in person, but for kids to have the opportunity to do athletics, to do the kind of, and to be in classrooms with their peers, with the teachers, any kind of significant spread in the school. We will likely see that the Pfizer vaccine will be available for 12 years and older. So that I anticipate that in 2 weeks from now, we'll probably get the go-ahead to start vaccinating at least 12-year-olds. And that'll be, I think, a big plus in terms of spread in schools as well.
Well, and it's probably hard to oversimplify it, but if there is the biggest issue, is it inertia to vaccines? Is it misinformation on vaccines, or is it a structural distribution? Is there one big issue that?
It's not a structural distribution. We have plenty of vaccine. I think it's as I said, it's philosophical. It's that I don't want to be told what to do by the government, and other people have some concerns about the safety and efficacy of the vaccine. But I think it's more philosophical. And public health is not a partisan issue. Public health serves everyone. And so I think that, unfortunately, there's been some, there has been some challenges there as well.
Well, great point. Well, one of the themes, obviously, you brought with you today was the role of businesses being able to help, and you had some great examples. And you asked our club if there's some feedback we can give to you, and we'll certainly be happy to provide whatever we can to help in your effort, since we are a collection of the city's bigger businesses. So, well, Kathleen, thank you so much for spending time with us today on such a vital, important topic. So much is reopening, so much excitement, and yet at the same time, there's still risk, and getting that balance is so important. So thank you for your leadership through the years. And Dave, thank you for such a great discussion today.
You're welcome.
Thanks for the opportunity.
It was a pleasure to be here.